Hello, hello, hello. I think that is my signature greeting. I want to say thank you, viewer, for joining us this lovely afternoon, where we are going to discuss matters budget advocacy. And the county of focus today is Kakamega. And the aim of this particular platform is to showcase whether to promote budget transparency and public engagement on matters budget, both at national and county level. So today I'm joined by Paul Odongo. Paul Odongo, karibu kwa studio.
Asante sana Violet, as you have put it. I'm Paul Odongo.
All right. Yeah, so Paul Odongo is a budget advocate based in Kakamega County, and he works for an organization called NRG Kenya. So he's going to share more about their work. So, Paul Odongo, over to you. Kindly introduce yourself and what NRG Kenya does.
Okay, I'm the founder Network for Research and Governance based in Kakamega, and I'm also the lead person. NRG was established in 2018 April with the main objective of strengthening the capacity of Kakamega residents in matters budget advocacy to ensure efficient service delivery. So basically what we do a lot of capacity building around organized groups like women groups, youth groups, and also we work in collaboration with CSO based in Kakamega, influencing policies that are related with the key budget documents. Yes.
So why did you decide that your organization is going to focus on budget advocacy?
Okay, this was informed by the nature of the work that I've been involved previously. I've been working on governance work with National Taxpayer Association. Then from there, I also recruited to be trained by the International Budget Partnership as a county budget facilitator. I also passionate about it. So having the knowledge and skill, I find it is necessary that I should cascade down and disseminate also to the community, because you find that matters budget, there are taxpayers and funds are trickling down from the national government to the county. Since citizens are taxpayers, they need to make sure that there are issues that are incorporated or prioritized in the budget document so that they can have efficient service delivery.
All right. So which budget documents have you engaged the citizens with in Kakamega County?
Okay, before that we had a good engagement with the International Budget Partnership, who have supported us with the capacity and even cascading down to equity forum that we had to invite participants from CSO, community administrators, budget champions to understand the issues around budget. And in this particular sessions of during the corona virus pandemic, we not had a lot of engagement with the duty bearers, and because of the restriction measures that were in place. So public participation actually was not done, but before that we had an engagement with organized CSO, organized group that is the Kakamega CSO network, where we had submitted a memo on CSFP for 2020-2021, specifically targeting health. And under that, we are looking at the preventive program. And also we engage on the ADP, which we also submitted a memo. Yes.
All right. So viewer, as we've had, Paul is one of the beneficiaries of a training that is organized by IBP Kenya, International Budget Partnership Kenya, and Uraia Trust. And You have mentioned the annual development plan. What is the annual development plan?
Basically, the annual development plan is just an extract of a 5-year plan called the County Integrated Development Plan. So every year, financial year, the county extracts a 1-year plan or one financial year plan called the Annual Development Plan, or abbreviated as ADP, which has the projects, it has the allocations, it also displays other things that are there that should be done that particular financial year. So it is done financially.
All
Yes.
right. And what about, you also talked about the CFSP. What is CFSP?
The CSFP is the County Physical Strategy Paper, and it composed of a budget language called 3 Ps. That is the priorities, projects, and projection. Then 1C, the C is for the ceilings. So it means that every time the county government is in the process of formulating the budget document, the CSFP comes between 15th of February to the public, where they have to prioritize their issues. Actually, it's also the document that has to inform the budget estimate. So the citizens here have to identify the project that have to be captured in that county fiscal strategy papers. They also have to see where they will be done. The main flagship project or the capital project should be there. Yeah, so it also had to show the larger programs and the ceilings. It means that sectors, they bid competitively. For example, we have health sector, we have agriculture, education. So the sector that bids high and the priorities are considered or factored in, it means it will get a huge allocation.
All right. And you mentioned that you mentioned that you're engaged in the health sector, and you focus more on budget advocacy with regard to health. I have a question for you. Is Kakamega County prioritizing health in its annual budget allocations?
Yes, of course, health is one of the priority in Kakamega County, and they have aligned with the agenda for health, the issues of agriculture, manufacturing, but manufacturing, they look at infrastructure. Yes. So looking at health, basically we assessed at the county fiscal strategy paper, but we find that there's a lot of gaps. And these gaps are basically on equipping the health facility. The governor has been putting infrastructure and upgrading of level 4 hospital facility at various sub-counties level, but there's challenges that need to be addressed. There's shortages of things like the beds or the water. There's issue of shortages of water across. Find a mother is delivering, but there's no water. They're just using the rainwater harvesting storage facilities. So we were so much focused on that they need to equip this health facility. We need to have expanded maternity services that can accommodate more mothers during delivery. We need also to sensitize them on NHIF coverage, because we find that there could be an NHIF desk, but citizens have not been sensitized that they need to register. Also, there's a program for Linda Mama under the RAMCAN that a mother should be given some stipend after delivery, and she should be delivered. She should deliver free. But you find that there have been challenges in terms of equipping those health facilities. So our memo is basically focusing on those issues, and also the issues of ambulance. So many, few ambulances that exist in the sub-county, like 2. So you are suggesting that every sub-county should have its own ambulance, because you find most of the mother here deliver at night. So there may be challenge of babies dying. So suggesting that this should be captured as a priority instead of building morgues. You find that a morgue is being built at Mumias East or Butere, and you have here like a Kakamega Palo. So do we need to prevent that, or do we need to put up more morgues?
All right, all right. So to address these challenges, have you reached out to the county government of Kakamega to showcase your concerns and asking them even for an increase in budget allocation toward health?
Yeah, of course, through the CSO network, and that we are supported by Uraia through NCSK, which is a key partner here that has been supporting advocacy work. we had a meeting with the chair for Budget Appropriation Committee, some representative from Health Department and Finance, and we articulated those issues to be captured as a priority. Also, we had another meeting with the Transparency International, where we had one representative from the County Budget and Economic Forum. So in advocacy, you can use allies and influencers, people who can support you to advocate your issues or can influence the process. So she was cooperative, and she promised that during their deliberation or their meeting, CBF meeting in Kisumu, our issues should be looked at, because now we can send also through her the information. Yes.
All right. So, do you have budget champions in Kakamega County who are also supporting you in your endeavors?
Yes, of course, we have budget champions in Kakamega, and they are really passionate about the work that you are doing. We have Christine, who is doing Budget Cafe in Shinyalu. We have Okwaro, who is supporting me here in Lurambi, and we are capacity building more. We actually need to go down to the community level, the lowest point of devolution, that we can have those kind of people to support our work. So mostly it's capacity. So apart from even just some few days training, IBP also can come in and pick some more budget champions to capacity build them for some time, for a bigger, maybe a long duration, so that they can have adequate capacity to disseminate this information at the community level.
All right. So I'm joined here by Ernest Okwaro, who is a budget champion in Kakamega County, and he works closely with Paul Odongo. Ernest, welcome to the studio. We also have Noel Lutomia, who's also a budget champion, who has also joined us on the set. So Ernest, kindly introduce yourself and tell us about your budget advocacy work in Kakamega County. Okay, seems like Ernest can't hear us. Noel, can you hear us? Hi, Noel. Hello, Noel. Can you hear us? We can't hear Noel. We can't even hear Ernest. Maybe you can text them, Paul, to tell them that we can't hear them. Yeah. All right. So, what challenges have you faced, Paul, with regard to what challenges have you faced with regard to budget advocacy work?
Okay, advocacy work is a continuous process, and of course there should be challenges that we face during this kind of engagements. And one is that there's issue of delay feedback, or maybe you don't get feedback at all. So you may submit a memo, and then it may take time, or a few issues sometimes may be reflected. And I think that has been an issue that we need to get strong allies who can push to the end. Because sometimes you find MCA say that there's an upper hand maybe from the executive controlling. You have captured, our views have been captured, but when it goes to the executive, they are again maybe deleted. So those are some of the challenges. I think the issues of political domineering or such a things, maybe, you see, I think we need to build a strong network with the MCA also, to work closely with them. But there have been like crying baby saying that, you know, we are hand-tied, but you tell them their role is oversight, representation, and legislation. So they have to play those roles. Then two, issues of access to information. The county may say that we are going to have public participation on this particular document like CSFP, but how many people does the information reach? Few people that are in the CSO network, we can have those information through the social media network, but what about the rest of the community or taxpayers? And when they engage there, Are they informed? Do they have the capacity to understand what they're going to deliberate on? Yeah, so those are some of the challenges. Sometimes maybe there is issues of accessibility of information. Maybe the document is not available, or it will be shared when the time has passed already. Yeah, the timeline, according to the budget timeline. So the information should be shared in time, and they should use all the available platform. If it is the media, if it's the local stations or FM, newspaper, there's this moving around, maybe is it called what? There's a way that they can advertise, yeah? They move around with the speaker and the vehicle just to tell people that we shall be having this public participation at this time, and this is the venue, and this is the document that we'll be discussing about. Yes.
All right. So we are joined in the studio by Noel Lutomia. Noel, are you able to hear us? Hello, Noel. Are you able to hear us? Kindly connect your audio. Noel, you're on mute. Noel, you're on mute. Kindly unmute your line. All right. So with regard now to the allocation that the county has allocated towards health, all right, we get to see that like in Nairobi County, it is at 21%. Though it is expected to be at 30%. All right. In Machakos County, it is at 32% at the county level, the amount that the county allocates towards health. So I'd like to ask, with regard now to Kakamega County, what is the percentage allocation that that particular county has allocated towards health? At least what we can say is that we can see that the counties have complied with the Abuja Declaration, which stated that counties should allocate 15% of their annual budget towards health. So, how much has Kakamega County allocated towards health?
Okay, we'll start with the program-based budget. Can you hear me?
Yes, I can hear you.
Okay, I'm getting some noise in the background. Okay, the program-based budget for 2019-2020, they've done it fairly good. In fact, on the development expenditure, it has surpassed 30%, and that's good beyond even the PFM Act. It's 47%, which is supposed to be 30%. And for health, it's above 30%, should be 35%. So they're doing better in terms of allocation. But the challenge is that priorities. We cannot continue upgrading infrastructure instead of equipping the facility. Because you cannot say every year we are upgrading. It's good that once you have done the upgrading, you need to do what? You need to equip the health facilities. You need to put the necessary amenities in those particular health facilities. So in allocation, that one is okay.
And have you maybe engaged in learning forums with other counties to see what they are doing with regard to health? Budget advocacy?
Not yet. We have not engaged with other counties on issues of budget advocacy on health. But what we did is a joint memo, which was convened by IBP, and we were focusing on Ramcan. I think we had so many stakeholders around that on issues of health. So that is what we got an opportunity to engage on.
All right. So even as your budget champions try to log in, I'd like to ask, have you managed maybe to have audience with the CEC Health in Kakamega County so that you may share your concerns, or even the governor himself?
Yes, through the CSO network, we have done that. We have reached the CC Health and even the director. And what is interesting is that he told us you can come up with citizen budget, which emanate from the community level, and put the issue that need to be captured there. So we actually planning to work on that. Come this next financial year, because this 2020, 2021 is almost going on, or the financial year is actually in circle. So we are waiting for to start engaging seriously from the other bit of 2021, 2022.
All right, all right. So we are coming to the end of this broadcast. So what message do you have for the community with regard to engaging in budget advocacy? And what message do you also have for the county government? And what message do you also have for the national government with regard even to allocations towards health?
Okay, the message that I have for communities is that one, they have to understand their key taxpayers, and they have to engage meaningfully during public participation. They need to turn out for these meetings, and also they need to work closely with us so that we can disseminate information to them. And they know that health is a very important aspect, because without health, it means that they cannot live long. They need to have a healthy life, and they are taxpayers. Then to the county government, they need to give us cooperation. We need to work in harmony. But of course, we have our own line that we cannot cross. We compromise timely sharing of information. They need to comply with the PFM Act. They need to support us. And the national government, I'm worried again about NHIF not covering the COVID patient. It means that COVID is not a disease like any other disease. People have been paying for NHIF, then you find that when it comes now to addressing issues of using the NHIF card for COVID, it becomes a challenge. They need to make sure that every patient is treated equally, and you should have affordable and accessible healthcare system. We should not be moving outside. Now, COVID has taught us a good lesson that you don't have to go to Europe to be treated. If you don't equip your health facility here in Kenya, you just die as any common person. So they need to equip a health facility properly with all the necessary facilities.
All right, all right. So because of network issues, your budget champions have not been able to join, but this show today was very informative, and it got to enable us, even me as an individual, to get to learn about your budget advocacy work in Kakamega, more so health budget advocacy. So I want to say thank you, Paul Odongo, for gracing the set. And viewer, we've come to the end of this particular show, and we are grateful that you joined, and we are going to host another guest soon who's also going to talk about the budget advocacy that they are doing in their other counties. You can you can follow us on Instagram at Budget Cafe Discussions, Twitter at Cafe Budget, Facebook Budget Cafe Discussions, and subscribe to our YouTube channel, Budget Cafe Discussion, so that you can be notified anytime we upload new videos with regard to matters budget. So from me to you, thank you, and thanks once again for joining us. And thanks, Paul, also for joining us.
Thank you very much for hosting me.
All right, great. So see you next time, our viewer, even as we discuss another particular subject with regard to Budget Cafe discussions. Asante. Yeah, so viewer, sorry, there was a little bit mishap. I put on the close out video of Real Talk Show, and it was supposed to be for the Budget Cafe, but these are issues that usually arise. But I just want to say thank you for joining us. See you next time. Okay.